This is the UKDS podcast, and you are here with me, Dr. Rajiv Patel, and my esteemed colleague and longtime friend, Dr. Drew Shah. Welcome, Drew.
Welcome, and thank you.
Exciting to be here. This is part one of a two-part series on everything to do with gums, gum disease, gum health. Now, you and I have been doing this, we've been dentists for over 20 years now.
Yeah, 23.
It's a long time, isn't it? But we aren't your regular high street dentist, are we? We are both periodontists. Can you explain to the listeners what a periodontist is?
Gum disease. I think periodontist is all about gums, all about the pink. I think that's a good way to say it, really.
Pink? Okay,
all
yeah.
about the pink, you know,
Less
in your
about
mouth.
the teeth?
And it holds your teeth in place, right? All the pink. So it's all the pink and everything under that holds your teeth in place, that supports your teeth. That really is the foundations of keeping your teeth stable, not moving, and healthy. That's probably a good way to put it in a very summary form.
And how does being a periodontist be different to being a general dentist?
We've spent extra years of training to actually focus on this area. You know, 4 years of specialty training.
Yeah, you're going to bring me out in sweats in a moment, but yeah,
Yes.
bad memories, but go on.
And this is what we do all day long. And in essence, as a periodontist, we are recognized by the General Dental Council in the UK as specialists, people who have gone through a very specific training pathway, passed very specific exams to be recognized as people who have knowledge, skills in this area. We generally know general dentistry. I think I did about 10 years of general dentistry before going onto the specialist pathway. You probably did about the amount, same time.
Less than you, yeah.
But in essence, we then went on and did further training around this area. And so most of the work we now do is focused on this day in, day out. And anything that's beyond that remit, yes, we probably have knowledge and could do it, but we pass it on to other specialists.
Well, that's quite handy, isn't it? Because that should mean you and I are well placed to talk about gum disease and gum health.
Yes.
So we should probably start at the beginning for our listeners and say, what is gum disease? What is gingivitis? What is periodontitis? These are all things that some people may have been told they have or worry they have. What are these things? What are the differences?
You know what? The best way to explain it is probably saying, look, your teeth first. Your teeth sit in your bone.
Yep.
They're well supported. Then the gum wraps around them and holds it in place. And that's where we get good, strong, solid teeth. But I like to bring in good old Western film. You know, you like those Western films?
Clint Eastwood?
The old Clint Eastwood.
Oh, John Wayne.
John Wayne.
Yep, love it.
But it's about the bad guys going in the bar. And the Clint Eastwood or the sheriff follows them. They have a fight. This damages the bar. And this is the analogy, right? Because when you don't brush well, when you don't clean well, and it's telling people cleaning well is Olympic standard well, you know, really high level. If you don't do that, this plaque, this bacteria, this tartar, all the gunk in your mouth collects on your gum line. And then it gets underneath the gum. Now, the challenge you've got is once it's under your gum, burrowed underneath, then these are the bad guys. And your toothbrush and your floss and your TP brushes and your interproximal brushes cannot get to it. The bad guys in the bar under your gum, your body doesn't like it. It sends its sheriffs, it sends its Clint Eastwoods to fight them. And in this fight, the only thing that's damaged is your gums. Now, gingivitis, basically your gums go red. They get angry, they get inflamed, they bleed.
Okay, yep.
But it's reversible. But when you get to periodontitis, your gums don't just get angry and bleed. They start getting loose. They move away from the teeth. They start receding. And the bone that holds your teeth also starts shrinking away. So everything holding your teeth is now disappearing slowly but surely. And the worry is if you don't get it checked out very soon, your teeth could be basically moving. You could make them very loose and eventually fall out.
So that's a key difference, isn't it? For gingivitis, we're saying that it's red gums, it's bleeding gums, but it's reversible.
Yeah.
Whereas periodontitis, it seems to affect more than just the gums. It's the surrounding bone.
Yes.
And the ligament that attaches the tooth to the bone.
Yes.
And if we lose those structures, then potentially we could lose our teeth.
We could. And the trouble is this really happens silently, right?
Yeah.
So many times you don't
painless,
recognize it's painless. And there are little signs. Sometimes you might get a bit of bleeding here and there. Sometimes some people find their teeth move. You know, the gap opens up between their teeth or the gums recede. But many times it happens so silently, it doesn't cause any pain. So we end up seeing patients when they have really advanced gum disease at times.
Yep, they do. So what should our listeners be looking out for at home in terms of signs that they might pick up on that they could have early disease, early gum disease, or possibly even more advanced disease? What can they see in the bathroom?
Some of the quiet signs we were saying, the gums are bleeding. You brush, you clean, and you find profuse bleeding of your gums. Very, very common sign, right? Most patients with that.
But not a good sign, is it? No.
It's not a good sign. If you got bleeding from your eye or if you got bleeding on your hand, you'd get it checked out fairly quickly. You wouldn't ignore it, would you?
Bleeding hands, that's slightly odd.
Yeah. So I think bleeding gums is odd in that respect. So just take it a bit seriously. But there are other things, right? You can get teeth that are moving. You have these gaps opening up between your teeth. You think, hold on, my teeth were in this position. Sometimes you get the loose teeth, which is fairly common, I suppose. I've seen sensitivity. Patients find the teeth are very sensitive because the gums are receding away.
Yep,
very,
seen that too.
Common as well. So various signs, but the most common thing we end up when they're advanced disease is patient finds a tooth's gone really loose. In fact, it's dropped out, or dentist said to take it out, and then they refer to us. And that you don't want to wait for that moment, really, do you?
And when you get into that end stage, obviously there's the risk of infection. So gum abscesses, swellings, bad taste, discharge, bad
smell.
breath. Bad breath.
Smell.
That's another common one, isn't it? We often hear about.
And
or smell even.
We call it halitosis, but it is. And sometimes you won't notice, but people tell you you've got bad breath or bad smell, and the gum disease is one of the potential causes of that.
Yeah. So we were talking there about how these bad guys in the Western, the plaque, the bacteria, they're the things that are causing our body to respond in a way that's damaging the tissues. So this is inflammation. So that's our body's response to the bacteria that's there. That's really what we're talking about. Are there any risk factors? Are there things that patients might have in their life? It might be genetic, it might be environmental things, it might be things they're doing socially that's going to exacerbate things, make it worse or possibly make it better?
Yeah, the biggest culprit, smoking.
Yeah.
Smoking, definitely. And the thing with smoking is it hides the bleeding, right? So some smokers...
Why does it hide the bleeding?
It kills the blood vessels in your gums, right?
Reduces the blood vessels.
And then you suddenly go, hold on, my gums are not bleeding. I'm okay. But you're smoking very silently. The bad guys are causing damage. This is like a fog, man. You got to be careful with that smoke. Diabetics have high risk of gum disease, and I know there's even talk, right? If you deal with the gum disease, you can improve the diabetes in some patients. But so careful. And how many times do we see patients who have gum disease and the diabetes has not been diagnosed? It's a very common factor. Genetics does play a role. I think it plays a role, but they've never really pointed a point to the genetics.
There's no single gene defect here, is there? No. There's familial history, so we know that if other members of your family, perhaps your parents, your siblings have it, then you might be more inclined to have it. But you're right, there's no single gene defect here, is there?
No, and then there's stress factors. People's lifestyle causes this. People who've had heart problems, those are a bit less directly linked, really.
Yeah.
But they are around. And this is one of the things, though, we've got to remember. Gum disease is the fact that the bad guys are the cause, but all these other things is exacerbated, and we cannot point to any one of them. So it's got multiple risk factors, and we've got to take all of this into account, really, in that case.
And we know that smoking doesn't cause gum disease, does it? It seems to make it worse. It might speed up the process. It might make it more severe, but it doesn't cause it.
It doesn't cause it directly.
Still,
remembering vapes
Vaping,
have also been known to cause the same
moment,
thing. Yeah. So you'd think, I don't smoke anymore, so I vape, but actually you're only replacing one risk factor with another.
No, that's very true. But is there a role for vaping, though?
Possibly some people use it to try and step away from the cigarettes, and then slowly they go off vaping. So it's an indirect route to stop smoking in some people. But I'm also cautious about that because vaping is a bit more easier to do, right? You take the vape out of your pocket and go, because smoking, you have to go outside.
Yeah, I agree, yeah.
So sometimes people can end up doing a bit more vaping than they were smoking.
Yep.
So
And we don't have enough data on vaping, do we? Really?
no,
The
we
long-term
don't.
effects. So
So we've got to keep an eye on
potentially
this.
risky.
But potentially risky, yes.
Yeah.
And some people go on the gums and hypnotherapy to stop smoking, but all that becomes part of the gum disease management.
Yeah.
But you've got to be aware of these factors.
Yeah. So we know that gum disease can really affect your day-to-day life. If you've got really sensitive teeth, really wobbly teeth, bleeding gums, your teeth are changing position, you might have a lot of gum recession.
Yeah.
All these things might affect your confidence when you're smiling. You might become ashamed of your teeth. These are quite common issues, but we're still just really talking about the mouth and the teeth, which is a big thing. But we also know gum disease is linked to other systemic health issues as well.
Yes, diabetes being the most popular
Most common one,
we
isn't it?
talked about,
Yeah,
the most
yeah.
common one. So we have to be aware about this because, how many times we've seen people who didn't even know they had diabetes, and then you see them with gum disease. You send them off for a blood test, they come back and go, "Oh, they diagnosed me with some diabetes." So I think you got to be aware. Heart disease, it could be common underlying factors, heart disease and gum disease, but we've known cardiovascular links with
There
gum
are clear
disease.
associations, aren't there? There's a lot
Associations.
good evidence now that suggests that there's a clear association between chronic gum disease, long-lasting gum disease that causes bone loss, and cardiovascular
Cardiovascular
events.
disease.
So that might be stroke, that might be heart attack. So we should care about gums, shouldn't we? Really, because it's not just about your mouth and your teeth. You might not care about your teeth, but hopefully you care about your heart.
health.
You need that pump in the middle of your chest, don't you?
Yeah, gum health is everything else health at some level.
It's all linked, isn't it?
It's all linked.
Doesn't sit there independently. Okay, so we practice periodontics on a daily basis and have done for many years. What are the common ways that we use? What are the things that we can use in our clinics to assess the health of your gums?
Well, there are various markers we use really in this case. Then the biggest marker is to check how well you're cleaning your teeth. We see our patients all day long and we check that. We actually measure the gums. And I was telling you the gums get loose around the teeth. And
Yep.
the thing to do is if your gums are very tight around the teeth and no bad guys have got in, and I put something between your tooth and your gum, it's not going to go very far down. But if suddenly your gums have got loose and you've lost the bone, there's a gap around your teeth. And if I put something in, it's going to sink in.
Okay, yeah.
That's a depth. We measure those depths around, and that tells us a very good way of checking if you have gum disease. Now, for me and the patients I see, the magic number is 5. Anything above 5, you might not win the lottery. You know.
What is the 5 referring
So
to?
5 millimeters. So when you put that thing
vertical
between
distance,
your
isn't it?
vertical distance
Yep.
between the gum line and how far it goes into that gap, and that's a very common measurement. We measure how much your gums have receded. We look at the bleeding points in your mouth. We look at how loose your teeth are. Now, some of your back teeth have multiple roots, and the gaps between those roots called furcations. We look at furcations.
Yep.
So there are various indices that we put together. So that's why consultation takes long. It takes, an hour, because one, you explain the good and bad guys, but then we got to know where they are and how far down do they go. So we measure all of this. We take x-rays. We look at your bone levels.
X-rays are really useful, aren't they? Give us a lot of information.
A lot.
Yeah,
And in
yeah.
fact, sometimes, you look at x-rays and you see all the bad guys, the plaque and the calculus stuck on your teeth.
Yeah, you
It's
can
like
see it on the X-rays, yeah.
Yeah, and it's like I suppose it's like limescale in a quarry, right? It's there, it's stuck, it's crazy. And this is causing damage all day long. Now, we then score it as well. I mean, you probably do this as well. You score
We
the
do,
amount
yeah,
of plaque
yeah,
in your mouth. Then imagine if you had your hand and I don't know, half your hand or 3/4 was bleeding, you'd be like, what's going on? So if your mouth has 50 to 75% plaque and 50 to 75% bleeding, that's what you're looking at.
It's a lot of inflammation.
It's a lot
Lots
of
of
inflammation and a lot of risk there.
Yeah.
So we want to make sure we look at all these, look at your risk profile. We do look at questions. Do you smoke? What's your diabetes? Any family diabetes? We put all this information together. Ultimately, our brain's then working like a computer, right?
Yep.
It's building all this information to try and
Analyzing
work
that
out what's your
data.
risk.
Yeah, absolutely. Yeah.
But what we do know is we can give you the risk. I can tell you how severe your gum disease is, how extensive it is. And the big worry is, can this be stopped?
That's a good question. And Drew, that is where we want to go next. In our next episode, in episode 2, we are going to look at the management of gum disease. How successful is it? Does it work? Are there alternatives? Should you take your teeth out? Should you think about dental implants? So we'd encourage all our listeners to tune in for the second episode. And until then, thank you very much, Drew.
Thank you. This is the UKDS podcast Perio.